Hello and welcome to Inside Ophthalmology. This is Dr. Amrit welcoming you to another lecture. Today we are studying the ocular blood supply. So in this video, we shall be talking about the ophthalmic artery and its branches, important relations of the ophthalmic artery and certain important clinical nuggets, blood supply of the retina, blood supply of the optic nerve and the optic tract, blood supply of the choroid, blood supply of the eyelid, conjunctiva, and the blood supply of the extraocular muscles. Trust me, it's going to be easy as long as you follow along and not skip the video in between. So let's get started. So this is a wonderful image showing the course and branches of the ophthalmic artery from the Netter's Atlas. But to understand the branches, we need to really dissect this image and look at the individual components of the ophthalmic artery one by one. So now let us simplify the image. To break it down further, let's look at this diagram and let's start labeling a few structures here. So this is your lacrimal gland. Then we have the lateral rectus present in the lateral part of the orbit. We have the optic nerve, the internal carotid artery which is situated here. Then we have the superior oblique in this diagram. This is the medial wall and the ethmoid sinus which is present in the medial wall of the orbit. And this spine structure, this spine-like structure here is the anterior clinoid process. Now, it is very important to know that the ophthalmic artery basically takes its origin from the internal carotid artery. And the internal carotid artery enters the skull through this foramen here, which is known as the foramen lacerum. Now, the ophthalmic artery basically arises from the medial aspect of the internal carotid artery and then it passes medial to this anterior clinoid process, and that is why I mentioned and talked about the anterior clinoid process before. Now, the ophthalmic artery after it actually takes its origin from the internal carotid artery that you can see over here. Okay, it passes medial to the anterior clinoid process and gives its first branch, and that first branch is actually the central retinal artery. Now, the central retinal artery, as you can see in this diagram, is basically traveling below the optic nerve for some distance and then it enters the optic nerve by piercing its dura mater, arachnoid mater and the pia mater. So as we know that the optic nerve is basically covered by the three sheaths which are also covering the brain. So your dura mater, arachnoid and the pia mater are also covering the optic nerve. So the central retinal artery basically travels for some distance below the optic nerve and then it is going to take a turn upwards and pierce the sheaths around the optic nerve and enters within the substance of the optic nerve. And this happens basically at a distance of 10 to 15 millimeters from the eyeball. And now it travels straight within the optic nerve and reaches the retina. Now, the course of the central retinal artery for which it was traveling inferiorly in the dural sheath surrounding the optic nerve and till the time it reaches the retina. So that part is actually known as the extraocular part of the central retinal artery. And now it is going to enter the eyeball through the lamina cribrosa, which is the fenestrated portion of the sclera. And through the lamina cribrosa, it is going to enter into the retina. Over here, as you can see, we have this opening in the sclera, which is called the optic cup. And in the nasal part of the optic cup is basically your central retinal artery situated. Now, this is going to basically give you two branches, superior and inferior. The superior branch and inferior branch are going to further divide dichotomously and they are going to give a nasal branch on the superior side, which is called a superior nasal branch. Another superior branch on the temporal side, which is called superior temporal branch. And then we also have two branches inferiorly, an inferior nasal and an inferior temporal branch. Okay. Now these branches further keep on dividing dichotomously up till the ora serrata. The part of the central retinal artery which has come up to the retina is basically called the intraocular part of the central retinal artery. The intraocular part basically is coursing over the surface of the retina and is actually it is basically situated superficial to the ganglion cell layer. Now these branches are actually going to send some other branches within the layer of retina, and it is going to supply the inner 6 layers of the retina. So this is one very important point, that the retina basically has 10 layers. However, the inner 6 layers of the retina are basically supplied by the central retinal artery. Okay, and another important point that you must remember is that the central retinal artery is basically entering at the nasal end of the optic disc, and then it is going to give further branches like the superior and the inferior trunks, which are further dividing into the superior nasal, superior temporal, inferior nasal and the inferior temporal branches. Now, another point that you must remember is that these branches of the central retinal artery, they do not supply the fovea. Instead, the fovea is supplied by the ciliary circulation or the choroidal circulation, and about that we will be talking in detail in a while. Okay, so remember, the inner 6 layers of the retina are supplied by the central retinal artery, but the fovea is not supplied by the central retinal artery. It is supplied by the choroidal circulation or the ciliary circulation. Okay. Now, this would be actually a correct time to discuss an important clinical nugget regarding the central retinal artery occlusion. Now, briefly, what happens in central retinal artery occlusion is that because of several reasons, the central retinal artery can get occluded, and therefore the blood supply to the retina will actually be will actually come to a halt, and because of that decrease in the blood supply because of the central retinal artery occlusion, you will see retinal edema. Okay, and this retinal edema basically gives a pale appearance to the retina because there is edema and also there is decreased blood supply to the retina. However, as we discussed that the central part of the retina or the fovea is basically supplied by the choroidal circulation, and in central retinal artery occlusion the choroidal circulation is normal, right? So as the choroidal circulation is normal, the central part of the retina or the fovea will actually retain its normal reddish orange appearance, whereas the surrounding retina is going to look paler in appearance, and because of which the central red normal foveal area, which is supplied by the ciliary circulation, is going to appear as a cherry red spot. Okay, so that is one clinical nugget regarding the central retinal artery occlusion, where you are going to see a generalized retinal edema along with a central cherry red spot. Now, approximately in about 20% of the population, there is actually a branch of the ciliary circulation which is called a cilioretinal artery. Okay, so the cilioretinal artery is not going to come from the central retinal artery. Instead, as the name suggests, it is actually coming from the ciliary circulation, but it is coming right up to the retina and supplying the superficial layers of the retina like this, and it is going to come out from this temporal end of the optic nerve and supply the area between the temporal part of the optic nerve and the macula. Okay, now in these 20% of the population who has cilioretinal artery, if they actually suffer from a central retinal artery occlusion, what will happen? Although the blood supply will be cut off because of central retinal artery occlusion, the area, the macular area, will now be spared and the patient will have good vision because of the normal cilioretinal artery. Okay, so that is one important clinical nugget that you have to remember. So if this artery is present, which is present in about 20% of the population, the central vision will be preserved even in a case of central retinal artery occlusion. So we discussed the first branch of the ophthalmic artery. So this is the internal carotid artery. From there we have the ophthalmic artery. Basically, it's going to travel from below and give basically the first branch, and that is called the central retinal artery, also referred to as the arteria centralis retina. So if you want to know in detail about the blood supply of the optic nerve head, I would advise you to visit this video on the blood supply of the optic nerve. The link is going to be present in the description box. Now moving on, the ophthalmic artery which was traveling inferior to the optic nerve will now take a turn and come out lateral to the optic nerve. Here, as it comes out in the lateral compartment of the orbit, it is basically situated, as you can see, medial to the muscle here, and this muscle is the lateral rectus. Apart from that, the third cranial nerve, which is the oculomotor nerve, and the sixth cranial nerve is also present lateral to the ophthalmic artery along with the ciliary ganglion. So what are the structures which are present lateral to the ophthalmic artery as it comes out in the lateral compartment? The ciliary ganglion, the third nerve, the sixth nerve, and the lateral rectus muscle. Okay. Now, the ophthalmic artery is going to actually give a branch in this lateral compartment, and this branch, as you can see, is going and supplying the lacrimal gland, and this branch is referred to as the lacrimal artery. Okay, so the lacrimal artery basically travels at the upper border of the lateral rectus and supplies the lacrimal gland. Now, also another important point that you must remember is that the lacrimal artery will give a branch which is called as the lateral palpebral artery, which is basically going to supply the lateral aspect of your eyelids. Okay. Apart from that, these lateral palpebral artery are also going to form arcades in the eyelids and supply the eyelids. So more about it in a while. So here, as you can see, this is the ophthalmic artery. It has actually appeared in the lateral compartment, and then it has given this branch laterally which is reaching up to the lacrimal gland, which is called the lacrimal artery. And the lacrimal artery in turn is giving these two branches which are the lateral palpebral artery. So it's very simple to remember. It's very easy to remember. Remember L for lacrimal artery and L for the lateral palpebral artery, and they're all situated in the lateral compartment of the orbit. Moving on, another branch that the ophthalmic artery is going to give in the lateral compartment is the recurrent meningeal artery. Okay, so this is the recurrent meningeal artery. Now, this recurrent meningeal artery, which is a branch of ophthalmic artery, which is in turn a branch of the internal carotid artery, is going to come out through the superior orbital fissure. And we talked about the superior orbital fissure in detail when we were talking about the anatomy of the extraocular muscle. Okay, so if you want, I will link down that video again in the description. So this recurrent meningeal artery is going to actually travel in the lateral part of the superior orbital fissure, and it's going to reach the dura mater, and there it is going to anastomose with the middle meningeal artery, which is a branch of external carotid artery. So if you're an anatomy student, you would know this is actually a common question that is asked, that mention the locations where the internal carotid artery and the external carotid artery anastomosis takes place. Okay, so this is one location of anastomosis between the recurrent meningeal artery and the middle meningeal artery, wherein the recurrent meningeal artery is a branch of internal carotid artery and the middle meningeal artery is a branch of external carotid artery. Now, the ophthalmic artery now decides that she's going to travel above the optic nerve. Okay, so it's going to cross now above the optic nerve, and as it crosses above the optic nerve, it now is going to reach the medial compartment of the orbit. And here in the medial compartment of the orbit, it is basically accompanied by two structures, superior ophthalmic vein and one more nerve, that is the nasociliary nerve. Okay, and this ophthalmic artery is basically traveling below the superior rectus muscle. So on top, if you see an axial section of the orbit, this diagram is basically an axial section. So on the top or the superior most, you have the superior rectus. Below that, you have the ophthalmic artery, and below that, you have the optic nerve. Okay, so here two important branches that are going to come out from the ophthalmic artery that you can see over here, these wavy branches on the either side of the optic nerve. They are very important for us, and these are called the ciliary arteries or the posterior ciliary arteries. Now, as you can see in this diagram also, these wavy branches on the either side of the optic nerve, these are basically your posterior ciliary arteries. So very important. So basically in both the eyes you have two posterior ciliary arteries. One which is present on the lateral aspect is called the lateral posterior ciliary artery, abbreviated as the LPCA. Then you have the one which is present on the medial aspect is called the medial posterior ciliary arteries. Now, these posterior ciliary arteries are going to further divide into numerous branches. Now, two branches are going to actually travel a long distance, and they're actually going to travel in the suprachoroidal space and reach right up to the ciliary body, where they're going to anastomose with the anterior ciliary artery to form the major arterial circle, okay, of the iris. Whereas a few branches will have a short distance and they are going to terminate here behind in the posterior region, and these are called the short posterior arteries. Okay, so to summarize, you have basically two trunks of the posterior ciliary arteries, medial and lateral. Then they're going to keep on dividing into multiple branches. Of course, a lot of those branches are going to terminate shortly thereafter, which are called the short posterior ciliary arteries. And two branches, one medial, one lateral, is going to travel a long distance in the suprachoroidal space to reach the ciliary body and form the major arterial circle, and those are called the long posterior ciliary arteries. So if you can see over here in this diagram also, we have long posterior ciliary arteries, we have short posterior ciliary arteries, and then we have a few short posterior ciliary arteries which are going to form a plexus around the optic nerve, which is called the circle of Zinn and Haller. So let us see. So first, we shall be talking about the short posterior ciliary arteries, right? So they are basically arising as two trunks from the ophthalmic artery, and then they're going to divide into these 10 to 20 branches. Now, an important point regarding the short posterior ciliary arteries is that they're going to pierce the sclera near the optic nerve, and then they're going to supply the choroid in a segmental manner. Okay, so they have the segmental distribution of the short posterior ciliary artery. However, some of the branches are going to form a plexus around, or you can say not plexus really, an anastomotic ring around the optic disc, which is called the circle of Zinn and Haller. Okay, so you can see short posterior ciliary artery around the optic nerve, which is called the paraoptic short posterior ciliary artery. Then you have the long posterior ciliary artery, one at 3 o'clock, one at 9 o'clock position. That is horizontally they are present. There are no long posterior ciliary artery vertically. Okay, and then we have some short posterior ciliary arteries which are present on the either side of the optic nerve. The short posterior ciliary arteries basically supply the choroid as far as the equator, and along with that it supplies the outer 4 layers of the retina. So what are these outer 4 layers of retina? We have the retinal pigment epithelium, which is the outermost. We have the layer of photoreceptors, the external limiting membrane, and the outer nuclear layer. So here this image actually tells you regarding the circle of Zinn and Haller. And if you could notice, these two branches here are the short posterior or the posterior ciliary arteries. You can see all these anastomotic blood supply most of it is actually coming from the posterior ciliary arteries or the short posterior ciliary artery. Okay, the central retinal artery is traveling in the center of the optic nerve and then supplying the retina. And as it supplies the retina, we can also say that it supplies the superficial head of the optic nerve, whereas most of the area of the optic nerve in the lamina cribrosa and also in the retrolaminar region is being supplied with the posterior ciliary artery. So more about this I have explained in the video on blood supply of the optic nerve. Now this would be a very important time to discuss a clinical nugget on the anterior ischemic optic neuropathy. Now, the oval that we discussed about, or the anastomotic ring that we discussed about, that forms circle of Zinn, can actually be divided into superior portion and inferior portion by the entry points of the medial and lateral short ciliary arteries which are forming it. Okay, so the ciliary arteries which are coming like this, they are going to form this circle. So arbitrarily you can divide it into a superior portion and an inferior portion. Now, this may be the anatomical basis for the altitudinal visual field loss that we see in case of the AION or the anterior ischemic optic neuropathy. So, what is anterior ischemic optic neuropathy? It is basically a disorder that happens because of the non-perfusion or hypoperfusion of the ciliary blood supply to the optic nerve head. So, when the central retinal artery get occluded, which is called central retinal artery occlusion, you will see a pale retina because the retina is being supplied. The inner 6 layers of the retina are being supplied by the central retinal artery, whereas the ciliary circulation is supplying the outer 4 layers and most of your optic nerve. And therefore, when the ciliary circulation is affected, the optic nerve head is affected and you will see that disc edema. Moreover, because the ciliary circulation has a segmental origin or it has a segmental supply, usually you will see either the upper half or the lower half of the optic disc will be affected in the form of optic disc edema. And if you go ahead and do a visual field, you will see that there will be a hemispherical field defect, and this hemispherical field defect is known as an altitudinal field defect. So in this picture, basically you have the inferior part of the disc affected and therefore you are seeing a superior field defect. Now here, important high yield point that I would like to mention is that the inferior field is more often affected, okay, because of the preferential involvement of the superior part of the ring of vessels. Okay, so superior part of the optic disc is affected more and therefore an inferior field defect is more common in AION. Okay, there is no adequate explanation for that, but remember that AION it basically leads to an inferior field defect because of the affliction of the superior part of the disc. Now, another clinical nugget regarding the cilioretinal artery. So by now I hope that you understood what's the central retinal artery and what are those ciliary arteries and where are they coming from. Now those ciliary arteries which are coming from behind, they can actually send a vessel and that vessel can actually enter the retina from the temporal part of the optic disc and supply the area of the macula. So that is called a cilioretinal artery because it is coming from the ciliary circulation and supplying the retina. Sometimes the cilioretinal artery will get occluded and therefore you will see this pale retina in the area which is supplied by the cilioretinal artery. Whereas sometimes, as we know that both of them are coming from the ciliary circulation or the posterior ciliary arteries, what will happen is that the cilioretinal artery along with the short posterior ciliary arteries will get occluded. And then you are going to see a picture of pale appearance or edematous disc along with this pale retina. So this is a combined occlusion of cilioretinal artery and anterior ischemic optic neuropathy. Right? Now what will happen if there is an ophthalmic artery occlusion? So if you know the answer, give that answer in the comment section. So I'm expecting a lot of answers after this. Okay. So again, if you want to know more about it, you can refer to the video on blood supply of the optic nerve. So we discussed about the short posterior ciliary arteries. Now let us move ahead and talk about the long posterior ciliary arteries. So what did I tell you? We have just two long posterior ciliary arteries which are coming from those posterior ciliary arteries, and one is coming on the medial aspect, one is coming at the lateral aspect. That means you have at 3 o'clock and 9 o'clock one long posterior ciliary artery. Now they are called long because they have a long course. They pierce the sclera obliquely and then they are going to enter the suprachoroidal space, reaching the ciliary body. Now by now I expect all of you to have visited those 3 videos on the anatomy of iris, anatomy of ciliary body and the anatomy of choroid, because only then you will understand what exactly am I talking about. So what is suprachoroidal space, right? And so these long posterior ciliary arteries basically travel in the suprachoroidal space and reach the anterior aspect of the ciliary body here. And if you would notice, they do not give any branches in this course. Instead, at the anterior end of the ciliary body, they are being joined by these arteries which are traveling along the muscles, and these arteries are the anterior ciliary arteries, and both of them are going to join together and form this anastomotic circle around the iris, which is called the major arterial circle. So you have the anterior ciliary arteries and then you have this long posterior ciliary arteries coming from behind, and then they are going to both join together and form the major arterial circle. Now, to summarize the blood supply by the or via the ciliary arteries, you can see this diagram. So here, this circle actually represents your equator. So if you see the part of the retina, that is the outer four layers of the retina, and the part of choroid, which is situated posterior to the equator, is basically supplied by the short posterior ciliary arteries, whereas the part of the retina and the choroid which are anterior to the equator are basically supplied by the posterior ciliary artery, that is the long posterior ciliary artery. So the long posterior ciliary arteries basically supply anterior to the equator, whereas the short posterior ciliary arteries basically supply posterior to the equator. And when we are talking about the retina, you have to remember that the central retinal artery is basically supplying the inner 6 layers of the retina, that is your internal limiting membrane, the nerve fiber layer, the ganglion cell layer, the inner plexiform, inner nuclear, and the outer plexiform layer. So that forms total 6 inner retinal layers, whereas the posterior ciliary artery or the ciliary circulation or the choroidal circulation will basically supply the outer 4 layers of retina, that is the outer nuclear layer, the external limiting membrane, the layers of photoreceptors, and the retinal pigment epithelium. Now, it is very important to remember that the vessels are actually, although the 4 layers, that is the outer 4 layers, are supplied with the choroidal circulation, the choroidal vessels are not present in the outer 4 layers of the retina. Because if there were choroidal vessels present in the outer 4 layers of the retina, that would actually interfere with the vision, and that would actually be a pathology. That is actually called choroidal neovascular membranes. Okay, so when I say that the choroidal circulation is responsible for taking care of the outer 4 layers of retina, it is basically by the means of diffusion of nutrients and metabolic waste products, and not per se by the infiltration of branches of the choroidal vessels into the outer 4 layers of the retina. So that is one very important point that you must remember. So with this, we finish these 2 branches of the ophthalmic arteries, that is the posterior ciliary arteries. So now let us revise. We have the internal carotid artery, which is giving the ophthalmic artery. Then the ophthalmic artery was giving this arteria centralis retina or the central retinal artery. Then it gave a lateral branch called the lacrimal artery. The lacrimal artery gave 2 branches, the lateral palpebral arteries. Then we have the 2 posterior ciliary arteries, which formed the short posterior ciliary arteries and the long posterior ciliary arteries. So, moving ahead, we know that these vessels are now going to cross, the ophthalmic artery is going to actually cross on top of the optic nerve now. And as it travels on top of the optic nerve, it gives one branch, and that branch basically travels above the superior rectus and the levator palpebrae superioris. Okay, and this branch is basically the supraorbital artery. Okay, so the supraorbital artery is usually accompanied with the supraorbital nerve, and it travels above these major muscles which are present in the superior aspect, the superior rectus and the levator palpebrae superioris. It basically travels just below the orbital roof, and then it comes out through a notch which is present in the superior orbital rim, and that notch is the supraorbital notch. Okay, so this artery that you can see here, which is coming out of the supraorbital notch, is a supraorbital branch of the ophthalmic artery. Now, 2 more branches come on the either side as the ophthalmic artery travels on top of the optic nerve, and these are called the muscular arteries. So we have a medial muscular artery and a lateral muscular artery. The medial muscular artery is basically going to supply the muscles which are present on the medial aspect. And what are these muscles? These are the medial rectus, the inferior rectus, and the inferior oblique. Whereas the lateral muscular arteries basically supply the superior rectus, the superior oblique, although they are present superiorly, but still the lateral rectus and the LPS. Okay, so remember, the medial rectus, the inferior rectus, and the inferior oblique form one group, and they are supplied by the medial muscular arteries, whereas the superior rectus, the superior oblique, that is the superiors, and the lateral rectus and the LPS, they form one group and they are supplied by the lateral muscular artery. So our discussion would not be complete if we don't talk about the anterior ciliary arteries. And here we are discussing about the muscular branches. That means we are talking about the blood supply of the extraocular muscles. right? So these muscular branches are actually going to give further branches, and these are called the anterior ciliary arteries, right? So the muscular arteries supply the muscles via the anterior ciliary arteries, and every muscle has two anterior ciliary arteries except your lateral rectus, which is a loner, which has only one single anterior ciliary artery. So this is very important point, that lateral rectus has only one anterior ciliary artery, whereas the rest of the muscles have two anterior ciliary arteries. Now, this anterior ciliary artery is important because apart from supplying the extraocular muscle, they also supply your sclera, conjunctiva, and the limbal area. Okay, they basically pierce the sclera at a distance of about 4 millimeters from the limbus, and here they are going to basically join the arteries which are coming from behind in the suprachoroidal space. And those arteries are, what are those? They are the long posterior ciliary arteries. So they join the long posterior ciliary artery along with the anterior ciliary artery and the long posterior ciliary artery. They join together at about 4 millimeter distance from the limbus. And at the anterior end of the ciliary body, they are going to form this circle of blood vessels, which is called the major arterial circle. This major arterial circle is going to then send branches into the iris, which are called the radial branches of the iris. And these radial branches of the iris are going to form an anastomotic ring around the pupil near the collarate and form the minor arterial circle. Okay, so again, it's very important for you to understand the anatomy of iris in order to understand all what we are talking about. So at this point, I would like to mention a clinical nugget regarding the anterior segment ischemia. Okay, so these anterior ciliary arteries, they are very important because here we are talking about the major arterial circle and the minor arterial circle. These major arterial circle are actually responsible for the perfusion of your anterior segment. And in this, the 70% of the blood supply is coming from the anterior ciliary artery, and only 30% is being contributed by the posterior ciliary artery. Therefore, whenever whenever a patient undergoes a squint surgery in which we are manipulating the muscles, okay, and if the surgery involves more than two recti muscles in one eye, the patient can land up into anterior segment ischemia because of the damage of the anterior ciliary artery. Okay, so it's always advisable that we do not operate on more than two recti muscle to prevent the risk of anterior segment ischemia. Very important point. Now, another important point to remember is that the posterior ciliary arteries, which are augmenting these arterial circles, they are coming from the horizontal direction. That means we do not have any posterior ciliary arteries coming from the vertical direction. Therefore, when we do surgeries on the vertical muscle, there is a severe risk of anterior segment ischemia compared to the surgery on the horizontal muscles, because in the vertical direction we do not have those posterior ciliary arteries which were contributing to 30% of the blood supply in the arterial circle. So moving on, I hope you are with me by now. So here, what happened to the ophthalmic artery? It crossed on top of the optic nerve, and now it has reached where? It has reached on the medial compartment. In the medial compartment, it encounters the medial wall of the orbit, and over there we have we basically have the sinuses, which are called the ethmoidal sinuses, and therefore they are going to give two branches. These are the anterior ethmoidal artery and the posterior ethmoidal artery. Now, these arteries are basically going to come out through their respective foramens. That means the anterior ethmoidal foramen and the posterior ethmoidal foramen. An important point regarding the anterior ethmoidal artery is that it's going to actually travel from the orbit straight into the anterior cranial fossa, and then it is going to come out again into the nasal cavity through the cribriform plate by piercing the cribriform plate, and then it comes out outside on the external aspect of the nose between the junction or at the junction of the nasal cartilage and the nasal bone. Okay, so till here you have the nasal bone, and here you have the nasal cartilage. So at the junction of the nasal bone and the nasal cartilage, it actually appears on the external aspect. So as you can see in this diagram, so here we have this anterior ethmoidal artery and here we have the posterior ethmoidal artery. So you should know that on the medial aspect we have these two branches. Now coming to the terminal branches. So now ultimately as the ophthalmic artery is going to reach the medial compartment, it travels anteriorly and then near the trochlea of the superior oblique, it is going to give its terminal branches, and these are the supratrochlear artery and the dorsal nasal artery. Okay, the dorsal nasal is basically going to supply the dorsum of your nose. So here, as you can see, we have this dorsal nasal artery which is coming like this. Okay. So above that we have the supratrochlear and the supraorbital nerves. Okay. So remember one nerve, one artery which was coming out from the supraorbital notch, that was a supraorbital artery, and then we have the supratrochlear artery, and then we have the dorsal nasal artery. Right. So these three arteries are present on top. The dorsal nasal artery can actually give two branches, and these are the medial palpebral arteries. One artery for the upper eyelid and one artery for the lower eyelid. At the same time, do you remember I mentioned that we have a lateral palpebral artery which is coming from the lacrimal artery, which is originating in the lateral aspect of the ophthalmic artery in the lateral compartment of the orbit. Now, these lateral palpebral artery and the medial palpebral artery are actually going to form these two arcades near the lid margin, and these arcades are called the superior and the inferior marginal arcade. Apart from that, in addition to that, we also have a peripheral arcade which is basically going to supply the fornix area of the eyelid, and that is called a superior peripheral arcade. Okay, so with this we have summarized the blood supply of the eyelids as well, that we have these arcades. We have two arcades in the upper lid and we have only one single arcade in the lower lid, and these are being formed from the medial palpebral artery, which is a branch of dorsal nasal artery, and the lateral palpebral artery, which is a branch of the lacrimal artery. So if you want to know more in detail about the blood supply of the eyelids in the conjunctiva, you can visit this video on the anatomy of conjunctiva, where we have discussed about the posterior conjunctival artery as well. Now the ocular circulation is not complete if you don't discuss the venous supply, okay, or the venous drainage. When we discuss about the venous drainage of the eyeball, we often come across terms like the vortex veins or the venous verticose. Now, basically, there are about 4 to 7 vortex veins, okay, in number. So, although the diagram shows 4, you have to remember that there are a lot of people who can have more than 4 vortex veins. Now, there are usually 2 vortex veins in the superior compartment. They are called superior temporal vortex veins and the superior nasal vortex veins, okay. So here you have the medial one, which is the nasal, and then you have the lateral, which is the temporal. Then you have inferior vortex veins, similarly the temporal inferior and the inferior nasal veins. Now, most of the time, these vortex veins basically can have a dilatation at their ends, and that is called a vortex vein ampulla. Very important. When we talk about these vortex veins, they are basically situated in between the recti muscle, and the distance at which they are separated, at which they are situated from the limbus is about 14 to 25 millimeters. Another important high yield point. Now, they're situated at that distance, and they are basically also situated within the sclera in a form of a canal. So you have the small canal within the sclera in which these are traveling, and that scleral canal is about 4 millimeters in length. Important clinical nugget is with the location of the vortex veins ampulla when seen on an indirect ophthalmoscopy. So when you carry out an indirect ophthalmoscopy, the ampulla of the vortex veins can actually be visible, and they're visible usually at a distance of about 8 to 9 millimeters from the ora serrata. Now, if you actually draw an imaginary circle drawn at the vortex veins ampulla, as you see on the indirect ophthalmoscopy, so that imaginary circle will actually represent your equator. So that is one important clinical nugget, that the position of the vortex veins can actually indirectly indicate the position of the equator on an indirect ophthalmoscopy. So this is a wide field angiography image in which you can actually show this position, you can actually see this position of the vortex veins. This is how the vortex veins basically look like, okay. Now, important point is that the uvea or the choroid is basically firmly attached at certain positions to the sclera. The sclera is the outer coat, the uvea is the inner coat, and the innermost coat is the retina. The uvea is firmly attached to the sclera at two positions. One is at the scleral sulcus, okay, and the other is at the ampulla or the vortex veins. And therefore, what happens is that whenever you have separation of the choroid or the uvea from the sclera because of presence of fluid in the suprachoroidal space, you get this lobular appearance or the lobular appearance of the detachment of the choroid. This lobular appearance occurs because the points where the vortex veins ampulla are situated, the choroid is firmly adhered to the underlying sclera and fluid cannot penetrate at those locations, and therefore the fluid is going to actually accumulate in this lobular configuration, and that is the reason why you get this trilobular or quadrilobular appearance of a full-fledged choroidal detachment. Now, so we basically have these vortex veins, okay, and these vortex veins are actually going to drain into the superior ophthalmic vein and the inferior ophthalmic vein. Now, corresponding to your anterior ciliary vein, you also have an corresponding to the anterior ciliary arteries, you have an anterior ciliary vein. And we also discussed about this anterior ciliary veins when we were talking about the trabecular meshwork. Okay, so these anterior ciliary veins, they are all going to go and drain into the vortex veins. Vortex veins are going to carry this deoxygenated blood, and they are going to drain into the superior ophthalmic and the inferior ophthalmic veins. That is, the superior vortex veins will drain into the superior, and the inferior vortex veins will drain into the inferior ophthalmic vein. And ultimately, along with the central retinal vein, they are going to drain into the cavernous sinus. So to understand that, it's very important that you understand the clinical anatomy of iris, clinical anatomy of the ciliary body and the ciliary process, and the clinical anatomy of the choroid. So all these videos are available on the channel. So to end, let us end with a clinical nugget regarding the choroidal effusion. So what is choroidal effusion? Choroidal effusion is basically collection of the fluid in the suprachoroidal space. That is the potential space present between the choroid and the sclera, which is usually dry. However, in certain situations, the venous drainage from the eyeball through the vortex veins can actually get impaired. Now, if you would remember, the choroidal veins or the vortex veins basically are traveling for about 4 millimeters length within the scleral canals. Now, if you put a scleral band, like seen in case of retinal detachment surgery, on top of the eyeball, what happens? These scleral buckles or scleral bands will basically compress your vortex veins, and the venous drainage will be impaired, because of which there will be collection of fluid in the suprachoroidal space, leading to choroidal effusion. Now, in some conditions like the uveal effusion syndrome, you have a very non-compliant sclera. The sclera here has increased thickness and very disorganized collagen fibers. So these disorganized collagen fibers in the sclera are also going to impede or impair the posterior segment drainage by causing a compression on the vortex veins and reducing the permeability of the sclera to the macromolecular substances, leading to the buildup of fluid within the suprachoroidal space and leading to this choroidal detachment or choroidal effusion. Okay, so two reasons that you can get a choroidal effusion is because of an external pressure, which is impeding the drainage of the impeding the venous drainage of the vortex veins, or sometimes the sclera itself is damaged or the sclera itself is non-compliant, impairing the posterior segment drainage. So that was all for today. I hope this video added some value to your life. If it did, kindly subscribe to our channel and hit that like button. It makes a lot of difference for us. Thank you and have a nice day.